na may stitches. Okay? So, kapag natahi na yan, gagawin ng doctor, bibilangin niya. 1, 2, 3, 4, 5, 6, 7, 8. So, mga 7 days or 5 days, sinabi ng doctor.
Hello mga kapasaway! Welcome back my munting channel, Pasaway si Inday. Let's go! Pasaway, proceed na mi sa caregiver. Nanggawas na ang tissue. Gawas na sila. Kay proceed mi sa caregiver. Tissue raman ilang kuwaon mga kakapasaway. Nang proceed mi sa mga makapasaway, proceed, gawas na sila ang mga tissue. Kami mga ikuha ng doble tissue caregiver, dili na pod mi kay ang among topic karon sa caregiver na kami. Yan, buntag niyo mga kapasaway.
So-called bed sore ulcer. Okay? It is also known as bed sore, bed ulcer, or decubitus ulcer. Okay? Isa lang ang meaning niya. Ibig sabihin, bed sore. Okay? Alam niyo ba yung bed sore? Alright, very good. So, what is the cause of the bed sore? Okay? There is a pressure in an area of the skin or underlying tissue that is dead or dying as a result of the loss of blood flow to the area. Meaning to say, nawalan ng blood flow dun sa area ng skin. Kaya nagka-bed sore. Okay? You can see if a caregiver is a good caregiver. For example, okay, there is a client, okay, bring to the home care. Okay? Nagtatrabaho kayo kunyari sa home care. Okay? And then the patient, very clean. No ulcer at all. Okay? Pero nung pinasa sa iyo na caregiver, at 1 month time, punong-puno ng bed sore ang pasyente nyo. So, is that a good caregiver? No. Meaning to say, you're not a good caregiver because you don't know how to take care of patient. Pinuno mo ng bed sore yung pasyente mo. Nang dinala sa iyo, walang ka bed sore. At the end of the day, puno ng bed sore because of your negligence. Okay? Okay. What are the signs and symptoms of bed sore? Number 1 is red skin. Also, there's a blister. And also an open sore. Okay, this is the factors causing the pressure ulcer. Number 1 is pressure. Okay, if you don't move your patient, okay, of course, it will develop a bed sore. For example, patient is lying too long, nakahiga lang siya ng isang position. Hindi nyo tineturn yung pasyente nyo. Of course, magkaka-bed sore siya. Right? Okay. Next is limited mobility. Meaning to say, hindi nyo siya ginagalaw. Yung kagaya nga, no? Sinabi ko na, hindi nyo man yan nilalakad, o hindi siya nag-change position, of course, they are very prone for bed sore. And also, poor nutrition. Pasyente nyo, hindi nakakain ng masustansyang pagkain. Okay? And vitamins. Okay? Fruits na very rich in vitamin C, which is very good sa skin condition ng pasyente. Okay? Friction. For example, minamassage nyo. Masyado nyo nirarab yung skin ng pasyente. Also, it may cause ulcer. Yung mga bedsheet ng pasyente, di ba, kailangan neatly fixed. Kailangan hindi lukot-lukot kasi nakaka-pressure din yun. Nagkakos din ng bed sore yun. Okay? Moisture. Same thing with you all. If your skin is very dry, di ba? Pag hinamot mo, ano mangyayari? Nagkakasore, di ba? Nagkakasugat. So, kailangan applyan nyo rin ng cream o lotion. Okay? Next is age. Sino ba yung mga prone sa bed sore? Who are the patients that are very prone for bed sore? All people. Very good. Okay? All people are very prone for bed sore. Why? Because of decreased mobility. Meaning to say, hindi nyo naigagala, especially those patients who are bedridden. Okay? Yung mga naka-bedridden na lang, forever na nakahiga na lang. They are the one very prone sa bed sore. Kasi nga, hindi na change ng position. And also, those patients with the disease. This is meaning to say, yung may mga chronic diseases. Okay? Alright? Okay. Okay. These are the parts where the common areas for bed sore. Yung mga areas na doon makikita yung bed sore. Doon sa head part. Okay, you also can see bed sore around the shoulder and also the sacrum. Okay, Yung sa buttocks, kasi matagal na nakaupo. Alright? Sa heel. Okay? Dun sa paa. Okay? Okay. For example, patient is lying too long. These are the areas where you can see the bed sore. Okay? Next. Okay. There are types of bed sore. Number one is stage one. Okay? You can see the skin is reddened. Okay? Meaning to say red color. Something like there is a rashes. Okay? So, nagpo-form na doon yung bed sore. Next. Okay? This is the example of a stage 1 pressure ulcer. Okay? You can see that the skin is still intact. Meaning to say, hindi pa siya nagiging blister. Okay? So, pag nakakita kayo ng ganitong reddish color na sa skin ng pasyente, okay? Sometimes it disappear within 15 to 30 minutes, nawawala siya. Okay? Next. Okay, this is the example of stage 2. Okay? Where the blister pops up. Okay? Yung blister niya, nagtanggal na, nagtubig na, tapos natuklap na. Meaning to say, yung first layer ng skin natin natuklap. So this is considered as a stage 2 ulcer, bed ulcer. This is the stage 3 ulcer where the wound become bigger compared to the stage 2. Okay? And this is the fourth one, which is the difficult to cure one, the stage 4. Okay? Where the damage extends to the muscles. Hindi lang sa muscles, sometimes naabot na dun sa bone ng pasyente. Okay? I hope that your patient won't go to this until this stage. Okay? Kawawa naman yung pasyente nyo. Right? Okay, what are the do's and don'ts? Okay? Number one is we have to use pillow, special form, to support the parts of the patient's body. For example, nakahiga siya, lagyan nyo ng unan, o kaya yung kamay niya, lagyan nyo ng unan dito, underneath. Okay? Para ma-support. Ganun din sa paa. And also, you have to change position. Okay? Very good. Every 2 hours. Okay? Pag pinosisyon yung pasyente na every 2 hours, huwag nyo naman i-position yung pasyente nyo, kapoposition nyo lang na right. Dito 15 minutes, pinosisyon nyo na naman sa left. Maya-maya, pinosisyon nyo na naman sa right ulit. Hindi na nakatulog ang pasyente nyo. Okay? Make sure that every 2 hours. Okay? Huwag yung position. Okay? Kawawa ang pasyente. Alright? Every 2 hours, remember. Okay? And avoid friction. Okay? Pag may ulcer, huwag nyo mamasahin, huwag nyo i-mamasage. Kung mag-a-apply kayo ng cream, when you want to apply cream, apply gently. Okay? Huwag naman yung dahil galit kayo sa pasyente. Okay? Bahala ka masaktan. Okay? Apply gently. Take the cream and apply gently. That's why you are called as a caregiver because you have to promote care, not pain for the patient. Right? Okay. Improve nutrition. Of course, we have to give patients very good nutritional food. Okay, kagaya nga those that are high in vitamin C. Okay, because vitamin C is very good for the skin. Very properly. The proper technique, how to clean the wound, proper medications or solutions that you are going to use for the patient. Okay? You massage, okay, you creating friction. Okay? Mas lalong lalala. Right? And also, she's also a speaker for baking. If you are interested in baking, you can ask Ma'am Michelle to conduct the training for the baking. We also the resource speaker for the OWWA. We also conduct training for the caregiving course and baking course. Okay, not only in Sabah but also in Kuala Lumpur, in Penang, in Johor, in any parts of Malaysia. Okay. Okay. So our topic for today, because I think we are running out of time. Our main topic today is about the pressure ulcer, and we don't know whether I have taught you all. So magkaka-better na talaga yung pasyente nyo kung hindi nyo papalitan ng diaper. That's why you are advised to change the diaper. Huwag magtipid. Okay? Sa Pilipinas kayo tipid-tipid. Right? Dito mayayaman sila. Okay? Use diaper, change diaper. Huwag lang magka-Bell's ulcer yung pasyente nyo. And also, you have to change position every 2 hours. Okay? For example, your patient already admitted in the hospital. Because sometimes, okay, caregiver also follows the patient in the hospital, right? There are some cases that caregiver also follow the patient. Kahit na na-admit na sa patient, yung patient sa hospital, andun pa rin yung caregiver. Okay, for example, yung nurse, sinay-lying niya sa right. Ikaw naman ang caregiver, tinurn mo sa left. Pumunta yung nurse, akala niya turn niya sa left, tinurn niya ulit. Okay? And up, hindi na naka-rest ang pasyente niyo. So, my advice is, if your patient's already admitted in the hospital, okay, don't intervene to the nurse's management. Pag nasa hospital na yung pasyente niyo, huwag niyo nang pakialaman. Okay? Huwag niyo na siyang pakikialaman kasi sila na ang bahala doon. Okay? Nagbabayad sila para alagaan yung pasyente. Bigyan niyo ng trabaho yung nurse. It's time for you to rest. When your patient is already discharged, then that is your role. Okay? Tingnan niyo kung ano yung trabaho ng nurse, kung ano yung ginagawa nila, just to observe. Pero kapag nandun na yung pasyente, let them. Okay? Unless they ask assistance from you. Okay? But don't go beyond their scope. Na kayo pa yung mauuna. Ako na lang. Kaya na yung nag-represent. Alam ko, pasyente ko to, alaga ko to, alam ko gusto niya. Okay. Diba? May mga ganun eh. Right? So, pag nasa hospital yung pasyente na yung nurses, yung mga doctors na yung mga ano. Okay? Okay. Si-share ko lang ha. May caregiver ako. Okay? Laban sa hospital. Sa KL. Okay? Bawag siya sa akin, ma'am. Binan po ako sa hospital. Ayaw ko papasukin. Sakot sabi ko, bakit? Sabi nila, pakailanera daw ako. Of course, napakailanera ko. Or, intervening the treatment. Kunyari yung pasyente nyo for operation. Okay? Ang order ng doctor is NBM. Do you know what is NBM? NBM. Alam niyo ba ibig sabihin? Sometimes, nakalagay yun sa folder ng pasyente. Sometimes, nakalagay sa bed ng pasyente. If you don't have the knowledge what is NBM, okay? Yung pala yung pasyente nyo is for operation. Sabi ng pasyente nyo, Inday, I'm so thirsty, can you give me water? Okay? Ikaw naman, dahil caregiver ka, binigyan mo ng water. Pasyente mo. Okay? Without knowing na, ang pasyente mo is for operation. Okay? So, nung nag-assess yung nurse, okay? Tinanong niya yung pasyente, did you take anything? Sabi niya, yes. I drink water. So, ano sasabihin niya? I-report ng nurse ngayon sa doctor. This patient consumed 1 glass of water. Anong gagawin ng doctor? He will cancel the operation. Okay? Kasi hindi nga pwedeng kumain. Pag sinabing NBM, meaning to say, kneel by mouth. Kneel by mouth meaning to say nothing to put inside your mouth. Okay? Bawal kumain, bawal uminom. Okay? So if you don't know anything, don't intervene. Ask. Okay? That's my advice to you all as a caregiver. Okay? Not all of you is knowledgeable on the abbreviations that is being used in the hospital or being used by the doctors or the nurses. So if you don't know anything, just ask. Okay? Alright? Naintindihan? Okay, very good. Okay? Then, drink plenty of water every day. Okay? To prevent dehydration. Para ma-prevent yung bed sore. Kasi pag dehydrate ka, do you know how to check whether you are dehydrated or not? Whether your patient is dehydrated or not? Yeah? Sorry? Do you know whether you are dehydrated or not? When a patient is dehydrated, okay? You can see patient is with a sunken eye, lubog yung mata. Diba? And then, she looks very pale. Right? Ano pa? Dry lips. Diba? Ano pa? Okay. Okay. For example, patient, even to yourself, you can check whether you are dehydrated. Try to pinch your skin. Here. Okay. Pag mabilis, ibig sabihin you're not dehydrated. Pero kapag finish mo yan, at dahan-dahan na bumabalik, meaning to say you are dehydrated. Okay? You can check with the patient. Okay? Especially when they are in the lying position. Kung nakahiga yung pasyente, okay? Kurutin niyo yung stomach niya, yung tiyan niya. Okay? Pag dahan-dahan na bumalik yan, meaning to say dehydrated ang pasyente niyo. Subukan niyo sa sarili niyo. Umiga kayo at check niyo. Pag bumalik na mabilis, ibig sabihin niyo not dehydrated. Okay? Okay, this is a way of how to check whether you are dehydrated or not. Okay, so to prevent that, especially nowadays, as it's very hot weather, we have a very hot weather nowadays, drink plenty of water. Okay? Next. So when there is a bed sore, okay, the bed sore, we have to do wound dressing. We have to clean the wound. Okay? We have to remove necrotic tissue, meaning to say. Okay, so as a caregiver, how do you take care of your patients with skin tear? Duties of a caregiver. Okay? You have to cut your fingernails short because for those patients which are very prone to skin tear, they are very easy to tear the skin. So make sure that your nail is short. That's why nurses, okay, doctors, okay, caregivers are not supposed to keep the nail long, right? We always keep our nails short. Okay? Kasi nga tendency na mas pasyente, lalo na pag may pasyente tayo na prone to skin tear. Okay? Also, ano pa? We have to, when we are on duty, avoid wearing jewelries. Kunyari, mag-duty ka doon sa pasyente mo, tabi-tabi niyo muna yung mga alahas niyo. Okay? Gamitin niyo na lang kapag mamamasyal kayo o makikipag-date kayo. Then, magsuot kayo ng mga kumikilang-kilang dyan. Pero kapag naka-duty kayo, tanggalin niyo muna yung mga yan. Alright? Okay? Okay? Remove all the devices. Kunyari, nasa bahay ng pasyente. Okay? Yung mga edge. Yeah? Table edge. Be very careful. Pag nasangga ng pasyente yan, those patients with very prone to skin tear, okay? Natamaan niya yan. Ayan na yung skin niya. So, make sure na tignan nyo yung mga, kunyari, yung tablecloth, okay? Na naka-hanging, masyadong mahaba. Make sure na hindi tapakan ng pasyente nyo, okay? Right? Also, maintain patient skin integrity, apply cream, apply lotion, okay? When you want to bathe your patient, when you want to dry your patient, pat dry, okay? And moisture the skin, okay? These are the duties of a caregiver for those patients with skin tear. Okay, another type of wound is puncture wound. Ito yung mga types ng wound na kunyari ay yung nakaapa ka ng pako. Okay? Another type is yung nakagat ka ng animal. Kunyari, nakagat ka ng aso. Okay? Nakagat ka, diba? Is considered a punctured wound. Okay? Next. So, this is the management for the punctured wound. Okay? Our aim, our goal, when there is a bleeding, we have to stop the bleeding. Okay? Then we apply the cream when we already do the dressing. We have to apply the cream. And if you see the object which is very rusty, for example, yung pako, okay? Pakalawang, make sure that you have to go and get your anti-tetanus injection. Okay? And also, kung nakagat kayo na aso, make sure that you have to get your anti-rabies injection. Okay? Okay, another type is scalp wound. Okay? So, kapag may scalp wound, ano natin babandisyon yan? Okay? Next. So, kapag may scalp wound, normally, ang ginagawa natin is, we have to shave the area. Sinishave natin. Okay? Kasi, mahirap plasteran. Pag may mga buhok-buhok, di ba? Plasteran mo yan. And pag tinanggal mo yung plaster, sasabihin ng pasyente kasi hihilahin mo yung plaster, hihilahin mo na yung buhok niya. That's why we need to plaster. We need to shave it. Okay? Shave the area. Okay, so kapag na-shave na natin, ang gagawin natin? Kapag may deep wound, kaya na ito. Next, madam. First, we have to clean area, and normally, we have to put the ribbon. Ganito. Pag natahina ng doctor, maglalagay siya ng ribbon. Kasi kapag plaster, normally hindi pa rin siya didikit masyado. Okay? So, gagawin ng pasyente, magtitreat siya ng ribbon. Tatali niya dun sa stitch. Okay? Imbis na maliit lang yung tahi niya na yung sinulit, hahabaan ng doktor para itali niya yung ribbon. Okay, so when you have this type of patient, okay, ano i-advise natin sa pasyente? Don't touch, ano pa? Don't scratch, ano pa? The most important thing is we have to advise our patient not to wet the wound. Okay? Sabihin natin sa pasyente na huwag basahin yung ulo. Pag maliligo siya, just shower the body part but not on the head. Kasi kapag nabasa, okay? Kasi hindi mo siya pwedeng tanggalin eh. Tatanggalin yan after 7 days. Okay? Pinapatakan lang siya ng gamot. Okay? So, make sure na hindi siya nababasa ng pasyente. Kasi pag lagi nababasa ng suso, nangyayari, mas na-infection. Okay? After 7 days, you have to bring your patient to see the doctor and remove the stitches. So, tatanggalin nila yung tahi. Together with this ribbon. Intindihan? Alright. Very good. So, another time, how we bandage it? Okay? Sometimes, hindi natin nilalagyan ng ribbon. So, gagawin ng doctor, binabandage na lang siya. Okay? Alright? Okay, so this is the management when we have a scalp wound. Okay, we have to wash the wound. Okay, if need to be stitched, the doctor will perform a procedure to stitch the wound, apply the prescribed antibiotic, and also we have to bandage or ribbon. So, gaya ng pinakita natin kanina. Next. Okay? O, stiff neck. Kailangan yung dalhin sa doctor. O yung pasyente nyo, parang feeling na naaantok. Okay? Mga warning signs to ha. Okay? Kapag ang pasyente nyo, hindi maigalaw ang kamay, o arm o leg, become unconscious, nahimatay. Kunyari, nauntog, nasugatan, nahimatay. Dalhin nyo sa doctor. Okay? O yung pasyente nyo is sumuka. That's why, kapag may nauuntog, di ba? Nauuntog. Okay? Nabago. Ito yung mga early signs, warning signs. Mga bata, nauuntog, nahulog. Obserbahan niyo yung alaga niyo. Kung nagsuka ba siya. Okay? Make sure na dalhin niyo sa doctor. These are the warning signs. Okay? Next. Okay. Just now, as what we have said, our goal is to, when there is a wound, our goal is to stop the bleeding. Okay? Restore functions to the affected area. Meaning to say, kunyari, construction worker, nahulog, from 5th floor, nahulog, nabali ang kamay. For example, daliri. Okay? Kita mo yung daliri niya doon. Okay? Pag dinala mo yung pasyente sa doctor o hospital, dalhin mo rin yung daliri. Okay? Pwede kita tayo yan ang kamay. Okay? So, what type of wound is this? Just now. So what we have discussed just now. Very good. This is the type of abrasion. Diba? So when we say abrasion, what you can observe sa wound na to? Nana? Ano pa? Dead skin. Okay. So anong gagawin natin pag may dead skin? Sabi natin. We have to remove it. Okay? Okay. Who are the caregivers here?
Sino yung may experience?
Okay, Madeira.
May experience. Sino yung may experience?
Okay. Wear your gloves. So our caregiver is about to clean the patient's wound. Okay, let's see. Okay, for example, your patient is having an ulcer. So I want to see how you clean your patient's wound. Okay, for example, we have solutions here. We have Hibitane and so these are the prescribed solutions that normally used in the clinics or in the hospital. Okay, so this is the gauze with the solution, for example, right? So how do you clean it? This one. Okay. So how do you clean a wound? Okay. So how do you clean a wound? I want to ask you.
Pwede bang Tagalog? Okay. Ano, tanggalin mo na yung, linisan mo na siya by using this one. So, yung steps. First,
Okay.
linisan.
Alright. For example, okay, you can either use something like that, use your hands, you can use a forceps, okay? If you want to clean the wound, for example, okay? For example, this is the solution, goes with the solution, okay? So you have to start where? Where you need to start? This is our wound.
Outside.
You have to
Outside.
start from the
Outside.
middle, from the wound itself, going to outside in a circular motion. Meaning to say, start ka sa wound, circular motion, throw, take another new gauze, again, start in the middle, in a circular motion, throw again, until you feel that the wound is already clean. Don't clean the wound from outside, go inside. That is the wrong way. Why? Because the bacteria you are putting into the
Inside.
wound, right? So make sure that you have to start from middle, outside, in a circular motion. Alright? Okay? Very good. Okay. So, kapag nalinis na, this one, the dead tissue, is what we said, remove it. Remove. It's okay to bleed. Okay? Kasi kapag tinanggal mo yan, automatic mag-bleed siya, right? So, it's okay to bleed because it allows the new skin to grow. So, remove. That is not needed there. So, kailangan malinis siya kagaya nung sa day 21. Okay? Pag malinis na, dapat ang sugat nyo is dito. Malinis. Okay? Pag ganyan ang sugat, matutuwa ako after sa inyo. Okay?
Pero
Alright.
paano po kung halimbawa kasi yung aking pasyente, no? Ganito siya. Yung paglilinis, so ganito siya. And then yung mga yan, yung mga dead cell na yan, yung mga dead skin na yan, ayaw niya pong ipatanggal yan. Ayaw niya ipatanggal yan dahil, ako masakit yata. Masakit yata.
Sometimes,
Kasi, oo, kasi ako takot din ako na ipuwersahin ko siya. Kasi ngayon po, mayroon siya dito eh. Sa puwit dahil hindi siya makamove, no? Nakaupo lang siya steady, pupunta lang kami ng banyo, tayo lang kami ng ganun. So ito, yan po yung isang kanina na ito siya, kasi hindi naman, ang boss ko naman, sinabi niya, kapag nasasaktan siya, hindi ka allowed na magtanggal niyan, wag. Yeah. So, hinahayaan ko
Okay.
siya.
For example, naka-plaster yan. Okay? As a caregiver, they just simply remove it, right? And your patient tendency is what? When you want to remove this one, tendency, especially when this is very tight, patient will scream, "Ah!" Right? So as a caregiver, how to promote care? When you want to remove this plaster, you have to use the solution, wet it so it can be easily removed. Because when you just simply remove it, tendency your patient will scream in pain. Diba? Kasi ang sakit niya eh, subukan nyo. Diba? So slowly, wet it, wet, until ma-remove nyo na yan. That's why you are a so-called caregiver because you are promoting care. Okay? Not until to the extent na humingiyak na yung pasyente nyo dyan. Wala kayong pakialam, linis lang kayo ng linis. Kailangan sabi nila, ay, tatanggalin ko ba ito? Of course, you cannot do it in one day. Okay? Maybe 2-3 times. Okay? Na pag nilinis nyo, nagsusoften na itong skin na to. Saka mo lang siya Okay. Slowly. That I tell you, you have to remove this. Of course, if this one is really very intact, meaning to say talaga nakadikit pa siya. Huwag nyo naman i-force talaga. Kawawa naman yung pasyente mo. Okay? Because it takes time. It takes time to heal. Especially those patients with diabetic. Okay? Mahirap gumaling yung sugat nila. It takes time. So, kailangan be patient. Okay? Pag sinabi ko remove the dead cell, don't purposely remove it. Okay? It takes time. Kasi lalambot yan eh. Until na matanggal nyo na. Okay, what type of wound is this? What type of wound is this? Ano yan? Punctured wound. Very good. This is called punctured wound. So, ano na-observehan nyo sa wound? May butas. Ano pa?
May dumi siya.
May dumi. Ano yung dumi na yan? Nana. You can see yellowish color, right? Okay? So normally, yung ginagawa natin, okay, when the doctor told you all, okay, use salt pack. Use salt pack meaning to say, this is the type of use salt solution. Meaning to say, ipapak natin na lang use salt solution. So what we do,
Discuss. We cut it into a tin. Na hanggang manipis yan. Okay? So, i-twist natin yan. Ilulubog natin dito sa solution. And then, slowly, yan, twist natin. And then, slowly, we have to insert it. Insert. Okay? Hanggang maipasok yung sa loob. Okay? And then, you pack it with the gauze and plaster it. Okay. So, yeah. So, the next day, kapag dressing nyo yan, pag tinanggal nyo yan, lahat ng nana nandun. Absorb ng gauze. Okay? So, slowly, every day, na nililinis nyo yan, slowly this hole will close. Okay? Get? Alright. Very good. Okay? Okay. That's all.
Talagang nakaka-dry siya ng skin, no? Ang soda cream.
Yeah?
Lagdan mo ng doder.
So, normally, depende kung anong gamot ang sabi ng doktor, ha? Okay? Okay na. Okay? Na may stitches. Okay? So, kapag natahi na yan, gagawin ng doktor, bibilangin niya. 1, 2, 3, 4, 5, 6, 7, 8. So, mga 7 days or 5 days, pag sinabi ng doctor, you need to come back to do STO. You need to say, suture remove. Kailangan tanggalin nila yan. Kung ilan tahi yan, ganun din dapat ang matanggal. Hindi walang maiiwan dyan. Alright?
Yes.
Okay. So,
Mga kapasaway, kuha kami ng pagkaon. Alingasa kay ni mga Bisaya kay makuha ang pagkaon. Alingasa gyud kayo. Asa may libre ani? Abi na kog kini. Kuha mi pagkaon. Libre among seminar. Asa man mukuha ko akani ako ang naisilipin. Asa man ni duha? Ay duha man di ay. Ang pagkaon tubig. Kani pagkaon. Kuha tag pagkaon mga kapasaway libre oh. Nice. Thank you. Thank you.